Hey guys, it's Dr. Bream. Thank you for joining us this late this morning. We have a special guest today, Lindsay Triplett. She's risk management for Central Carolina Insurance in Salisbury, North Carolina. She's a friend of Bream Medical and has helped us with several situations that we've had. And thankfully is joining us today to talk about Medishare. She and her family use Medishare and is kind enough to come on today and talk with us about how it works. I know this has been one thing patients with our subscription service that we offer, which we are doing a promotion on during open enrollment, that we're doing it for $100 a month instead of $125 per month. That people say, well, what if something terrible happens to me? What if I get in a car wreck? What if I have appendicitis? What if I have to go to the ER for something? That's what people seem to be mostly concerned about with subscription type service or a direct primary care services. What if I have to go to the hospital? And so I wanted to have somebody with experience with Medishare who could lead us through these discussions and talk about how it works and why she chose it. So with that being said, Lindsay, thank you for coming on today. And just talk a little bit about what maybe led you to Medishare over more traditional type coverage.
Hi, thank you for having me. Well, I originally looked into Medishare when I was a 1099 contract worker, so essentially self-employed. At the time, I could purchase health insurance, of course, from the marketplace, traditional health insurance, but I didn't qualify for much of a subsidy. So it was in the range of $500 to $600 per month per person. And this is when I was quite a bit younger. So
Right.
it probably would be more now. Yeah. So, and of course it still had a high deductible, didn't have the greatest, the lowest co-pays, et cetera, et cetera. So I was recommended Christian Healthcare Ministries, which is just one of many health share programs. And I don't specifically recommend that one, but I do have experience with that one. There are lots of good options out there. Liberty Health Share is another one that I know of and have definitely spoken with people who have it. So I started looking into this. I did a lot of research, a lot of reading on their website, a lot of, Googling of reviews, what kind of experiences did people have with it. And I felt it was a good option because at the time I was, well, and I still am now, thankfully, but at the time I was, young, healthy, wasn't on a whole lot of monthly prescriptions, if any, I think at the time. So it was just, it was a quarter of the cost, if not less. So for me, it just made total sense. Yes, as a 1099 or self-employed person, I could technically write off 100% of my premium, but I could not my spouse or child. So therefore, it made even more sense to put them on health share than it did myself. So that's kind of how it all started and how I decided to do that.
Right. And I can echo those sentiments because that's something we've looked into as well. Myself as an ER physician, we're all contracted through the hospital as 1099 employees too. And so to get insurance through the company, I think this open enrollment period was for a family of four, $2,760 a month.
Mm-hmm.
And again, we don't qualify for any subsidy or anything either. I think right now through the marketplace, we were paying close to $1,700 a month for me, my wife, and two healthy young kids, and we're all under 40, and we're all pretty healthy. So we don't really use it very much, and that's where I talk about the Bream Medical subscription service. It's really geared toward people who who are contractors, who are self-employed, who things you can't get employee sponsored healthcare. And we're not trying to get you to leave. If you have good coverage through your employer, we're certainly not encouraging you to leave your great coverage from your employer to come to the Bream Medical subscription plan. But there are a lot of folks out there like me and like Lindsay who are really getting these very high cost plans, and they're very expensive. And I know when I priced Medishare out for our family, because that's what we're going to go to as well, it was $589 per month for our family of four, as opposed to $1,700 a month which is what we were getting through a plan like Blue Cross. So for people who are self-employed, independent contractors, who are not given insurance through their employer, that's where the Bream Medical subscription plan really can be beneficial, at least for your outpatient needs. And then if you pair it with something like a Medishare option, instead of paying these very high premiums and high deductibles, then it gives you an option that is a lot cheaper. So Lindsay, so tell me, when you've had to use it, what does your Medishare plan cover and not cover?
Okay, so I also want to echo what you said. At the time, for two people, for two individuals, adults, the Medishare that I was paying for was $300 a month, and that was the top tier that I could buy. So that was obviously very economical. Also, I also would never encourage that you leave your company sponsored good health plan. I am not 1099 anymore. I'm W-2, and I do have a good plan through work. So I do use it. However, even then, a subscription plan through Bream Medical would be great. And had a subscription plan through something like you been available a few years ago when I had Medishare, it would have sweetened the deal. It would have been so much better. And I'll explain why in a minute. But basically, as far as what's covered and what's not covered, it really depends on what level you purchase. I know with CH Ministries, you can purchase bronze, silver, and gold level. I purchased gold because it had no cap on the amount of coverage. It was like unlimited, whereas silver maybe was capped at 500,000 or $1 million. So in the instance of a major surgery or cancer, you could exhaust those limits pretty quickly. From my understanding with CH Ministries, almost everything was covered. The only thing that I think was not with them would have been any sort of claim arising out of illegal activity, drug use, things of that nature. However, mental health, there were still a lot of mental health things that were covered. And one of the best things I thought that was covered, which at the time we were still working on getting covered under traditional healthcare, is maternity. Maternity was absolutely covered, and it was covered at a much lower deductible than traditional health plans. They don't call it a deductible with health share. You have to realize that with health share, they're going to call it that, health share, not health insurance. Make it very clear that it is not considered health insurance. And they call it deductible. I'm not sure what they call it. I have to go back and look. I'm drawing a blank right now, but that's not what they call it. Maybe a retention or something of that sort. But what I would call it a deductible was only $500 at the time on the highest tier. So it covers, I mean, like I said, other than a claim arising out of illegal activity, which with Liberty Health Share or some of the other non-religious based health share companies may have not been the case. That was just with this particular one. So, but let me put it this way. You don't have your traditional copay. When you go to the doctor, it's covered. Your preventative visit is covered, or your sick visit, but you do have to file it and be reimbursed. It's not covered on a copay basis.
Right. And I think that's where to do a Medishare type plan, you will have to do some legwork on your own. So you would ask for the statement, you'd ask for the statement, and you would file with Medishare for your share to be reimbursed, and they would mail the check back to you. And I know I talked to one of my patients who uses Medishare a couple of days, maybe like a week or so ago, and that's what the patient had discussed as well, was that for some things, like incidental things, like when you come to a primary care appointment, where for us it's, a follow-up appointment is usually about $99 for a cholesterol visit or something like that, just a simple follow-up. It's just not really worth it to file for a $99 share. But the patient did mention that her husband had a colonoscopy, and that the colonoscopy was completely reimbursed. And when her husband had a procedure, it was also completely reimbursed. They filed it Medishare will send your share in, and will send your share to you to pay your office or the hospital or whatnot. So you do have to do a little additional legwork on the back end to get the share completed. Would be, I guess, what I would say from what I understand.
Yeah, that's true. I mean, you do have to do the filing on your own. And CH Ministries has forms online, fillable forms. And the biggest thing is getting the paperwork from the provider's office with the correct codes and things in order to file it. But again, with a subscription, I'm not trying to necessarily plug you here, but with a subscription plan with Bream Medical, you wouldn't have to worry about that, because from what I understand about your subscription plan, discounted right now at $100 a month. Okay, so you buy Medishare and then you add the $100 subscription plan per person with you. Then is it my understanding that you get so many visits included, correct?
Right. I mean, you essentially would get 7 visits a year. A full health maintenance physical yearly. Where you'd have all your your hour-long visit, your EKG, your labs, all that stuff done. Then you'd have 4 follow-up or urgent care visits yearly. You can say if you have cholesterol, you could use 2 as a cholesterol visit or 2 urgent care, and then 2 telemedicine visits a year. So it's pretty uncommon that somebody has to go to the doctor 7 times a year.
Right.
Some patients, I guess, who are more chronically ill, maybe COPD or something like that, might have to. But even at that, if you go over, we discount your visits heavily, and our visits are already fairly heavily discounted. Like if you came in for a COPD visit for urgent care, it'd probably be a moderate visit, which might be $175. And then if you got a couple breathing treatments, that might add $20 to the visit, and then you're out the door for $200. Whereas if you were going to a different urgent care, you'd have to pay $100 copay, and then you're going to get a bill from the urgent care for the cost of the nebs and all the other stuff that the provider visit and all that stuff. And I think obviously for us, transparency is a very big deal. That if you're one of our subscription patients or your patient doesn't have insurance, we're going to tell you exactly how much it costs out the door, and there's not going to be any surprise bills that follow you later.
Right.
But to your point, we obviously will work with you, but it's very rare that with the $100 a month that you're going to exceed 7 visits a year. But if you do, we'll certainly work with you.
Right. So in this case, if you had a subscription plan through you and you had Medishare, you're really likely only going to have to go through that paperwork filing issue yourself if you have a major claim. For instance, a major broken bone and a surgery. Let's say you break your wrist and you've got to have surgery as a result of that. I do know that is covered by Medishare at, like I said, at the one I had, a $500 deductible, which is really good. And then after that, it's covered at 100%. There is no 80, 20, 70, 30 after that. And you don't really deal with out-of-pocket limits. So let's say you broke your wrist, you have to have surgery as a result. Even the medication, even prescriptions, there is generally not prescription coverage through health Medishare programs, except for prescriptions related to an incident. So in other words, if you are given pain medication or an antibiotic or anything as a result of an incident that occurs, say the broken wrist, that would be covered for a period of time. I think it's 3 months or whatever. That being said, those are really the only claims that you're going to have to deal with. Yes, you would have to get all your paperwork, and you would have to file the claim for the ortho visit, file the claim for the surgery, the anesthesia, all of that good stuff. And it would take some time to get reimbursed, but we do know that typically they give you time to pay these bills. They're not going to not operate on your wrist. So I do know, I have a client who did have Christian Healthcare Ministries, and she did have to file for cancer. And her comment to me was, yes, the paperwork was a little bit, it was something she constantly had to do, but she did get reimbursed. Every time she filed, she got reimbursed. So she was very pleased with it.
Right. And so I guess my final question here would be, so kind of touching on that, obviously it sounds like doing the paperwork filing and some of the legwork would be something that is maybe a downside of Medishare. And I guess you mentioned some issues with maybe prescription medications. I guess that's outpatient prescription medications. Like they're going to cover your chemo, they're going to cover your chemo treatment, your chemo drugs. This is if you come see us and you got a urinary tract infection and we send in, Keflex to the medicine shop.
Correct.
They're going to, and again, this is where it's just kind of, you don't want to necessarily nickel and dime them. That's going to be a $5 prescription. And that's where you have somebody like us and that's where it's important, for smaller, providers, smaller business like us. I'm going to pick up the phone and I'm going to call my friends at the medicine shop and say, hey, I've got this, this, and this. What is the cheapest way to do this? And so
Right.
we will work with you. And this is where I think sort of working for a non-corporate entity that you're not trying to see 4,000 patients is beneficial, right? So we have the time, we can pick up the phone and we can make the call and try to figure out what the best thing to do with you, but the best thing to do with your prescriptions is. That way we're not, leaving you with a significantly high bill with your insurance for the pay out of pocket with Medishare. And I would say, I would note that, kind of this happens with insurance too, that you'll go to a pharmacy. This happened when we even had recurrent outer ear infections a couple of years ago, that I had a prescription for cortispore. So I gave them my insurance card, my Blue Cross card. And that way they said to me $90. I'm like, $90 for cortisporin? So I go to my phone, go to rx.com. Okay. Well, it says here I can pay $36 for my cortisporin. And they just roll their eyes at you. I'm like, okay, I want to use the $36 option instead of using my insurance. So just as a note, a lot of times it is actually cheaper to not file your insurance for your prescriptions and just pay for them. They don't want, it's a dirty secret. They don't want you to know that. They don't want you to know that the cash price is cheaper than what they'll get reimbursed if you use your insurance, because it's all in some ways a game like that. But so I don't want that to frighten people out of Medishare that you'll have to pay for your prescriptions out of pocket, because a lot of times, even with insurance, it's cheaper to do it that way.
Yeah, another example of that would be Moose Pharmacy helped me out with this one. My son needed a nebulizer, just a little, typical breathing machine. He needed some budesonide when he had RSV as a young infant, and went to file it through my insurance. And of course, Kyle called me and said, you don't want to do that. You just want to buy this from me. You do not want to file this through your insurance, because filing it through my insurance, the nebulizer was going to cost almost $300. Whereas this little machine I purchased directly from him for cash for $39. So, and the medicine I did file, but the machine I did not. So, I mean, there's all sorts of instances in that. And yes, I would say the major drawback of Medishare, probably more the lack of prescription of chronic prescription coverage. If you're a diabetic, I would not say that Medishare is probably for you at this point. And then the other drawback would be some of the paperwork, but the paperwork is coming a long way. I think part of the problem is providers' offices not understanding what you need, that you need the discounted cash price, that you do not have health insurance, and that you need all of that detailed. So my suggestion would be, if you do have Medishare, make sure that you also are, choose your provider wisely. I know that Bream Medical is good at this, because I've had to ask for a printout from you guys for my flex pay, for instance. You have to have, if you're used to filing like flex pay through work or anything like that, your HSA, and you've got to have those detailed reports, that you can do this. Okay. It's not that hard. But you guys are very good about that. I had it before I left that day. There are some providers
that we're very transparent. Like I said, what our price is out the door, because we have all our codes built out. So we know exactly what our price is out the door.
Right. And they don't have the time to just print it for you that day. They're like, oh, you have to deal with our insurance office or whatever else. I mean, at Bream Medical, you're all right there. So somebody prints it for you and you're on your way. So yeah, I would say those are the two drawbacks, but I mean, those are minimal drawbacks in my opinion. again, and like you said, just don't shy away because of the lack of prescription coverage, because you can often buy generic drugs cash price for cheaper than your copay on your insurance, traditional insurance anyway.
Right.
Yeah.
Because I had the same issue you had when, conveniently, same drug, budesonide, when I had COVID. Obviously, you can tell we're friends with the Moose pharmacies and the medicine shops of the world. Because they are, we as small business in Salisbury support the other small businesses in Salisbury. And so when I had COVID, I sent everything to the medicine shop and they filed my insurance. And, Teresa called me. She says, "Hey, it's going to be over $400 for this." I was like, she goes, "But if you pay cash, it'll be it's like $109 out the door." I was like, "Okay, here you go. $109 is a lot better than filing my insurance and paying $400." So, but we will work with you. But again, I want to touch on the point that, Lindsay made. I think Medishare is a great option for patients who are likely to enroll in a subscription plan, who are trying to avoid high deductible plans because they're usually younger, self-employed, don't have a lot of chronic health conditions. If you have if you're, 65, of course, then you're probably, qualified for Medicare. But, if you have a bunch of chronic health issues, if you have COPD, diabetes, high blood pressure, you've had a heart attack with 2 stents, Medishare is probably not the right plan for you. But if you're 45 and healthy and you're only on maybe 1 or 2 subscription medications, and you have low thyroid, and you see us to follow your thyroid, that you're probably a great candidate for a subscription plan plus Medishare. But if you have 25 health problems, then Medishare is probably not for you. And we'll be honest with you. I mean, I think somebody came to me and asked me, "Look, I was thinking about doing X, Y, or Z." We'd be honest about what we thought. We would never advise our patients to do something that we felt is detrimental to them, for sure.
Right. And I would give you the same advice. I obviously can offer, where I am, I can offer traditional health insurance, but I am honest with my clients when they come in and they're just like, I can't pay that. And I'm like, okay, well, what kind of conditions do you have? And let's sit down and see if there's a better option for you. And this is a better option sometimes for people. Real quick, another thing, another client of mine, MRIs, some MRIs would be covered under a Medishare plan, some would not, but even in traditional health insurance, you have to go through quite a few hoops to get an MRI now. You cannot just show up and get one. Right. They have to be referred. There has to be a lot of work involved on your part and your provider's part for that. Shop around for those as well. You can call 10 different, imaging places in a 50-mile radius of you, and you will get a different cash price from each one of them on an MRI. So that's another area in which you can save money. I have a friend who had to have an MRI on her foot, and she saved $700 simply by driving to Concord and to a different place to get it.
And we had a patient recently in the office who needed a low dose CT scan for lung cancer screening, and we called around and we were able to find the low dose CT scan cash price, radiology, not scan, read by radiologist, like the whole total cost was $210.
Yeah, that's a big difference. Bottom line is Medishare can give you, in addition to a subscription plan with a primary provider like Bream Medical, Medishare can give you peace of mind if something major happens, is what it can do. And you can also buy a catastrophic plan through a traditional health insurance, but they're more, in my experience, what I see, monthly premium of those is more than Medishare with far less coverage. So that's where you need to consider the Medishare. And they still don't have, catastrophic plans still don't have monthly prescription coverages and things like that. They're very limited. So like I said, bottom line is, this is the what if I get cancer? What if I, fall and break both of my legs, have a major accident and need surgery, that's where your Medishare plan comes into place.
Gotcha. I think that's a good place to wrap up with this being your Medishare being peace of mind. I'd also somewhat shamelessly plug that, having Bream Medical in your corner should also provide you peace of mind. We really do work hard to keep our patients out of the hospital. I think we've sent a very few patients over, and I think when they've all been sent over, they've had something very wrong. An emergency gallbladder surgery, an emergency appendectomy, things like that. Zach, was Johnny on the spot, and it's like, hey, I think we need to get you to the ER right away. And so, unfortunately, we do have to send patients over to the ER for certain things, but again, with us having significant experience with that, we know what needs to go and we know what doesn't need to go. And we're certainly more accustomed to seeing sicker patients in our clinic. And, the great thing is we can bring you back tomorrow and look at you again. If you're a subscription patient or really any patient of ours, we can bring you back in and see you tomorrow and just do a brief reassessment and see how you're doing. But so we do a lot to try to give our patients peace of mind. I think Medishare also provides that peace of mind. And again, we're not necessarily trying to push anybody toward one option or another. Like Lindsay said, there are traditional insurance catastrophic plans that are out there. There's HSAs, healthcare savings account. There are FSAs. There's more than one way to skin this cat, but in general, we think Medishare is a decent option and would be something that we think would be well paired with a Bream Medical subscription plan as you consider your options this open enrollment season. So anyway, thanks for joining us today. Thank you again to Lindsay for being with us. If you have any questions, if you're maybe in the market for a new commercial insurance plan, our friends over at Central Carolina Insurance Agency would be happy to help. Lindsay and her team will be happy to help. And if you need any healthcare needs, Bream Medical obviously be happy to help out and do anything we can for you and our patients. So anyway, hope you guys have a great afternoon. And thank you, Lindsay, again. Thank you for joining us.
Thank you.
Take care.